Good morning and welcome to the 6th Interdisciplinary International Congress, Renewable Energies, Industrial Maintenance, Mechatronics and Informatics, CIERMMI 2021. My name is MERAZ and I will present the project Health Risk Behaviors and Emotional State of Medical Students. The collaborators are González, Ramírez, Leivy, Patricia, CHÁVEZ, TOSTADO, Mariana, Guadalupe, and González, HEREDIA, Tonalá. Well, nowadays, healthy lifestyle behavior starts to be an essential part of our life. There is a wide physical and psychological problems derived from unhealthy behavior. An improper lifestyle could develop some mental health disorders like anxiety, depression, among others. There is a variety of risk health behavior caused by new social requirements. However, individuals' lifestyle is highly influenced by culture, beliefs, and the motivation of those individuals themselves. It's a fact young adults are going to engage in some sort of risk behavior, such as use of alcohol, tobacco, drugs, risk sexual behaviors, inadequate physical activity, or just lack of physical activity or some kind of exercise. In addition, there is the dietary problems, such as eating fast food or poor diet due to the lack of the time. University students are at the stage in their lives which involves certain change to their lifestyle, such as development of new social networks and greater autonomy in their behavior. These changes are often influenced by social factors that impact the way they carry out their routine, and therefore it leads to risk behaviors that conduct to an unhealthy lifestyle. Also, this stage can continue throughout adulthood. Well, there is a wide evidence about the benefits of adding healthy behaviors in our lifestyle, especially to avoid mental disorders such as anxiety, depression, stress, among others. Universities must take into account the importance of implementing programs to promote healthy lifestyle habits that allow prevention of common mental disorders such as anxiety and depression, as we say, especially in medical students. Well, we performed an analytical cross-sectional study with 173 public university students. Sociodemographic, clinical data, and physical activity were collected through interviews, and at the same time, body mass index was calculated. After that, a series of tests were applied. First, we applied the VEC anxiety inventory to measure anxiety, of course. This test consists of 21 items with a score ranging between 0 and 63, which correspond from a normal level to severe level of anxiety. Then we apply the VEC depression inventory that measures depression with 21 items. Then we apply the alcohol use disorder identification test that contains 10 questions that identify the use of alcohol in the last 12 months. Finally, we apply the Ferguson physical nicotine dependence scale that was applied to measure the cigarette consumption and the level of smoking compulsion and abstinence. All the qualitative and quantitative variables were defined by frequency and percentage, as well as average and standard deviation. The chi-quadrada square or the Fisher-Starr statistic test was used to know if there were any difference due to the presence of anxiety, depression, or gender. Additionally, we tested with the odds ratio that estimate for the groups with significant difference existed. Well, the results of the study are as follows. The average age of the student is 20.9 years. Of the population of the students survived, 65.9% was single, 31.8% was engaged, and only 2.3% was married. Also, 22% of the population were women and 28% was men. Well, 30% of the students were students between the first and the second year of the medical training. 15% were between the third and the fourth year, and 15% were in the last 2 years of their students. About mental health, we found that 59.9% of the students present anxiety and 27% present depression. On the other hand, a high percentage of the students present risk health behaviors. That's 56.1% were sedentary, 0.6% had nicotine dependence, 19.7% reported risk alcohol consumption, 22% were overweight, and 15% were obese. There was significant difference between sedentary individuals and those who performed regular physical activity in relation to anxiety. Also, we found significant difference among the students with risk alcohol consumption habits and those who did not have any problems with alcohol consumption in relation to depression. Gender was decisive for some difference. Anxiety and depression were found to be more prevalent among women than men. That's it, 62% versus 46% and 34% versus 10% respectively. In terms of eating habits, men had higher prevalence of obesity than women, with a 52% versus 22% respectively. Well, in conclusion, we report that medical students carrying a large academic load, which could potentially contribute to present a variety of risk factors against health. At the top of the list of risk factors are anxiety, followed by depression. Both of them are linked to sedentary lifestyle and overweight problems. Gender plays an important role over the emotional state. Since women present highest prevalence of anxiety and depression. Anxiety is the most common mental health problems among students, followed also by depression. Medical schools are known to be a stressful environment that leads to negative effects on the students' physical and psychological health. Finally, the continued effort and contribution of such a study will be useful to educators, administrators, and practitioners to inform efforts to optimize the health, safety, and efficiency of our future medical practitioners. Here is some reference that we use for this project. And we want to appreciate the valuable participation of medical students from the Tonalá University Center belonging to the Universidad of Guadalajara. For me, it's all. Thank you very much.